All right, getting into some dense stuff today, diving deep into metabolic acid-based
Mm.
disorders. You sent over some excerpts from a medical journal article,
Yeah.
and wow, this is complicated.
It is.
But luckily, we've got our expert here to help us break it all down. We'll be your guides. We're going to understand these imbalances, what causes them, how doctors diagnose them, and most importantly, how are they treated?
Yeah, it's kind of like your decoder ring for this stuff.
I like that, a decoder ring.
Yeah.
So let's just jump right into it with the first one here, metabolic acidosis. Now, the article describes this as when your blood pH gets too low, so it's too acidic.
Basically, you can think about it like a seesaw, right?
Okay.
And on one side you have acids, and then on the other side you have bases.
Okay.
And it needs to be balanced.
Gotcha.
And when it starts to tip too far to the acidic side, that's where the problems can start to arise.
Makes sense. And the article mentions something called bicarbonate here.
Yeah, bicarbonate is really interesting. So it's like our body's natural buffer. You can kind of think about it like a chemical antacid in a way.
Right.
It helps to neutralize the excess acid and kind of keep everything in check. But here's the thing that I think is really interesting. Even if someone's bicarbonate levels look normal on a test, it doesn't necessarily mean that everything is okay.
Oh, really?
Yeah, there could be something else going on kind of behind the scenes.
Okay, so it's kind of like if you're checking the air in your tires,
Yeah.
one tire might look fine, but you might have a slow leak.
Exactly, exactly. And so that's why they use something called an anion gap. Have you heard of this?
Yeah, the anion gap, yeah.
Yeah, so the anion gap can help them to figure out what kind of metabolic acidosis is going on. So think about it this way. Your blood is full of these positively and negatively charged particles, cations, and anions.
Okay.
And so the anion gap is really just measuring the difference between them.
So if it's a bigger gap than normal, that tells us something.
Exactly. And so when you have a high anion gap, that often points to a few specific things. So this is where you see things like diabetic ketoacidosis, which is where your body basically starts to break down fat for energy at a really high rate. And then it creates these acidic byproducts.
Oh, wow.
And then another one would be like kidney failure, where your kidneys just aren't effectively filtering out those acids anymore.
So these are like some serious conditions that can cause this.
Yes, very serious conditions.
Right.
And then there's this other one that's kind of interesting called normal anion gap metabolic acidosis. And that one's a little trickier. But the article mentions like severe diarrhea can actually be a cause of this.
Really?
Yeah, because you're losing a lot of fluids.
Okay.
And when you lose those fluids, it can throw off that balance.
So it's not just what's going on inside, but what we're losing too.
Yeah.
That's really interesting. Now, the article keeps mentioning these two types of metabolic acidosis. It says AGGM and NAGGM. Are those just abbreviations for high and normal anion gap?
Yeah, you got it. They are. It's kind of like doctor shorthand for high anion gap metabolic acidosis or normal,
Okay.
AGMA, and then NAGGM. And that just helps them to communicate quickly like, oh, we're dealing with this.
Makes sense.
You know what I mean?
Yeah, yeah.
So HAGMA, like we said, that's usually caused by those more kind of serious things like DKA, the diabetic ketoacidosis, or kidney failure. And the article gave a really good mnemonic for remembering the causes of HAGMA.
Okay.
Have you heard of this one?
Lay it on me.
It's COLT.
Okay.
So it stands for ketoacidosis.
Okay.
Uremia, which is basically your kidney function.
Got ya.
Lactate, so that's like another byproduct of your metabolism.
Okay.
And then toxins.
The Kelati, got it.
It's an easy way to remember.
I like it. Mnemonics are good. So what about NAGMA? So that's the normal Angie gap. What's going on there?
Right. So that one, like we were saying, tends to be a little trickier.
Okay.
To pinpoint the exact cause.
Yeah.
But like we mentioned, diarrhea can be a contributing factor. Okay.
Also, sometimes certain types of kidney issues,
Okay.
or even, and this is kind of interesting, overuse of normal saline solution, like the IV fluids.
Oh, wow. Okay.
So it can even be like medically induced, which is interesting.
So depending on whether it's HAGMA or NAGMA, doctors can start to kind of narrow down the cause of it.
Yeah, exactly.
Yeah.
Exactly. They're like detectives, right?
Right.
They're using these clues to kind of figure out, like, what's the root of the problem?
I like it.
And that's obviously going to inform how they treat it.
This is already making me look at metabolic acidosis a lot differently. It's not just one thing, it's a whole bunch of possibilities.
Exactly, yeah.
So we've covered metabolic acidosis, but this article also mentions metabolic alkalosis. What's that all about?
Metabolic alkalosis. You can think of that as the flip side.
Okay.
So if acidosis is that seesaw tipping too far towards acid, alkalosis is tipping too far toward base.
Got it. Still about balance.
Still about balance, exactly. So that pH level is going too high.
Okay. What kind of things throw that off? Well, one of the most common culprits is excessive vomiting.
Oh, okay.
So if you're throwing up a lot,
Yeah.
you're losing a lot of stomach acid. And believe it or not, your body needs that to maintain that balance.
Interesting.
Certain diuretics, those medications that help get rid of excess fluid, they can actually also cause this.
Really?
Yeah, because they can cause your body to flush out too much potassium.
Potassium again. Seems to be important.
It's super important.
Okay.
Potassium, it does so much. It's really essential for your nerves, muscles to function properly. So when your potassium levels are off, it can really impact a lot of different systems in your body.
It's all connected.
It really is all connected. And that's why diagnosing these things accurately is so important.
Okay.
It's not enough to just treat the symptoms. You have to really get down to the root cause and address that to restore that balance.
How do they actually treat these imbalances?
So with metabolic acidosis, it can really depend on what's causing it, how severe it is. So sometimes, for example, in severe cases of high anion gap metabolic acidosis, they might use sodium bicarbonate,
Okay.
which we talked about.
Right. It's like that natural buffer.
It is that natural buffer.
Yeah.
So it helps to kind of quickly neutralize that excess acid.
Give you a little boost back to the balanced state.
Exactly. But it's not a permanent solution, obviously,
Right.
because the underlying cause still needs to be addressed.
Right. You can't just keep taking sodium bicarbonate.
Exactly. So, for example, if it's diabetic ketoacidosis, they need to manage their blood sugar. If it's kidney failure, they need to address that.
Well, the root problem.
Exactly. Now, with normal anion gap metabolic acidosis, treatment often involves addressing that underlying cause directly. So, for example, we talked about severe diarrhea.
Right.
A lot of times, it's really about just rehydrating the patient,
Makes sense.
getting those fluids back in,
Yeah.
replenishing those lost electrolytes.
So it's all about getting back into balance.
Exactly. Now, with metabolic alkalosis, that's where treatment often involves replenishing those fluids and electrolytes. So again, because we talked about vomiting or diuretic use,
So kind of the same approach.
kind of the same approach. You're replenishing what your body has lost, essentially.
So you're like restocking its supply closet.
Yes, restocking that supply closet.
Uh-oh.
That's a good way to put it.
Making sure it's got everything it needs.
Exactly. And then in some cases, they might use medications
Okay.
to kind of manage the condition. So, for example, if you have excessive vomiting, they might give you something to reduce stomach acid production.
Okay. That makes sense.
Yeah. So it really is kind of like a detective game. You have to figure out what's causing it,
Yeah.
and then you address that with the right tools.
Right. And that's where the whole diagnosis comes in, right?
Exactly. The article talks a lot about how they use, blood tests, medical history, clinical judgment.
Yeah.
They'll look at the bicarbonate levels, obviously.
Right.
But they're also going to look at your electrolyte levels, how your kidneys are functioning, all these different factors.
So it's really looking at the whole picture.
Looking at the whole picture, putting together that puzzle.
It's not as easy as just one blood test.
Not at all.
I-
And sometimes they even have to do additional calculations based on those blood tests. The article mentions something called a delta-delta. Have you heard of this?
That delta-delta, no. What is that?
Yeah, it sounds really complicated. But basically, it helps them figure out if there's a mixed acid-base disturbance.
Mixed disturbance, what does that mean?
So it basically just means that the body might be trying to compensate for one imbalance by creating another one.
Oh, wow. Okay.
So, for example, someone with metabolic acidosis might start breathing faster to get rid of more carbon dioxide, which is acidic, right?
Right.
But while that can help temporarily, it can also lead to a mixed disturbance, which makes the diagnosis trickier.
So it's like you're trying to fix a leaky faucet, and you accidentally cause a burst pipe somewhere else.
That's a great way to put it.
It's all connected.
It is. It highlights how interconnected all these systems are and how carefully they have to be managed.
Wow. It's amazing how our bodies try to fix things, even if it kind of backfires sometimes. But I'm curious, we've gone through all of this. Why does this even matter for the average person? What's the takeaway here for them?
Yeah, that's the big question, right? Like, why should I care?
Right.
And it's actually pretty straightforward. When these things get out of balance, it can really impact your day-to-day life.
Okay, so the article mentions fatigue, muscle cramps, but what else are we talking about here? What are some of the more serious things that can happen?
Yeah, you have to think about it this way. Your blood pH affects every single cell in your body, right?
Right.
So if that gets out of whack, it can really throw a wrench in everything, like your heart, your lungs, even your brain, your kidneys. It affects everything.
Oh, it's like the foundation of your health is a little off.
Exactly. So in the short term, yeah, you might just feel tired. You might feel weak, a little confused. Maybe your breathing's off. But long term, if it's not taken care of, it can actually increase your risk for some pretty serious things like bone disease, kidney stones, even heart problems.
Okay, so it's not something to ignore, for sure.
Yes.
So what can you do? What are some things people should watch out for?
Well, if you have any chronic conditions
Right.
like diabetes or kidney disease, you should talk to your doctor. Just ask them about it. Ask them, what's my risk for this kind of thing? Because early detection is key. If you catch it early, you can manage it so much better.
So knowing your risk factors, what about just in general? If you don't have one of those conditions, are there any warning signs to look out for?
For sure, yeah. If you have that constant fatigue, the muscle weakness we were talking about, nausea, anything with your breathing, especially if it comes out of nowhere, or you're like, this doesn't make sense, why am I feeling this? Definitely get checked out by a doctor. It never hurts to ask.
Because you might just write it off as, oh, I'm just tired or whatever. But it could be something more serious. This is really interesting.
Right. It's about listening to your body and being your own advocate.
Right, right.
Don't be afraid to ask your doctor questions, even if you think they sound kind of silly.
Exactly. The more you know, right?
Exactly.
The more you can advocate for yourself. Well, I feel like we could talk about this for another hour, but we are coming up on time. So any final thoughts before we wrap up?
Just remember, this is just scratching the surface.
Yeah.
There's a ton of info out there about this stuff. So if you want to learn more, keep researching. Talk to your doctor. Don't be afraid to keep asking questions.
Yeah. And like you said, it's important. What might seem like a small imbalance can actually have a big effect on your health.
Exactly.
Well, with that, we'll wrap up this deep dive on metabolic acid-base disorders. Until next time, everyone, stay curious.